Hello nurses, welcome to another session of Nurse Talk. Today we are going to see two vascular disorders. First one is Buergers disease and the next one is Raynaud's disorder. Vascular disease means a disease affecting the blood vessel of the human body, and this vascular disease what we are going to discuss first is Buergers disease. Buergers disease is also known as TAO or thromboangiitis obliterans. This is caused because of vasculitis. What is itis means? Itis means inflammation. So if the patient has got any inflammation on the blood vessels, inflammation of blood vessels result in Buergers disease. Okay, this is most commonly seen in the distal upper and lower limbs. Distal means it is away from the center part of the body. So most of the cases this is affected on the fingers of upper and lower limbs. In most cases this is seen in the Buergers disease or thromboangiitis obliterans is seen in male patients between the age of 20 to 40 years, and also the patient who has a history of tobacco or smoking usage. Tobacco usage or smoking. This is the main etiology seen in the occurrence of Buergers disease. Remember, Buergers disease is vasculitis or inflammation of the blood vessels. What happens here? This is a normal blood vessel shown in here. In case if there is an inflammation, the blood vessel is going to constrict, resulting in the reduction of blood flow towards the extremities of the body. If the patient will not get sufficient blood towards the extremities, the patient is going to end up with having sores or discoloration. See, you can see discoloration, and it also end up in gangrenes. Gangrenes is causing because of the reduction in blood flow or reduction in the supply of oxygen towards the tissues of the body. So in Buergers disease, what is happening is an inflammation of blood vessels resulting in reduction of blood flow, and that causes the soreness or gangrene on the extremities. And another thing, important thing to remember when we are talking about the Buergers disease is intermittent claudication. Intermittent claudication. Intermittent claudication is the terminology we use when the patient has an increase in pain during exercise and the reduction in pain during rest. So remember, if a patient has got an increase in pain when the patient is having a strenuous activity or physical activity, and the patient's pain will subdue during the rest, then it is intermittent claudication. What is the cause for this pain? This is because of the reduction in blood supply to the muscles. So when his patient is having a strenuous activity or patient is doing something, the blood supply to the patient is already having a vasculitis resulting in the reduction of blood supply. But if the patient is having any strenuous activity, the blood supply is going to reduce furthermore, or oxygen supply is going to reduce furthermore, resulting in an increased pain. It is a pain in the muscles from inadequate blood supply. So intermittent claudication is caused because of the reduction of oxygen supply or blood supply to the extremities, and this pain will be increasing during an exercise or strenuous activity, and the pain will subside during the rest time of the patient. So this is the clinical manifestation. Major clinical manifestation of Buergers disease is intermittent claudication. The patient might be having reduced pulse in extremities as well, due to the reduced blood flow or lack of oxygen supply towards the extremities. Most of the times the extremities will be colored in red color, and also the skin will be very cool. We all know if there is no blood supply to the extremities will be very cold, and also reduction of pulse is also seen in Buergers disease. So most important thing to remember in here is Buergers disease is a vasculitis or inflammatory disease condition. Inflammation of the blood vessels result in Buergers disease, and intermittent claudication is also seen in Buergers disease. Buergers disease is also known as TAO or thromboangiitis obliterans, and this is a complication. The complication of Buergers disease can be ulceration or gangrene. Patient may even lose the part of extremities because of the gangrene. Okay, so this is the complication. This is the complication of Buergers disease. This is the complications of Buergers disease. And how are we going to manage? The management include vasodilators. Why vasodilators? Vasodilators means the medications used to dilate the blood vessels. So why vasodilators? Because what is happening here is the inflammation of blood vessels, and this inflammation results in the constriction of the blood vessels that will reduce the blood flow towards the extremities. So we have to administer vasodilators for the patient and also encourage or educate the patient to reduce the smoking, because the smoking can be a risk factor or etiology for the Buergers disease. Okay, this is called Buergers. This is all about Buergers disease. Remember, it is a vasculitis or inflammatory disease condition. Next, we are moving to Raynaud syndrome. Raynaud syndrome is also a vascular disorder, but what is happening here is vasospasm. That means there is no inflammation here, but there is a spasm of blood vessels, which is resulting in the reduction of blood flow towards the extremities. Same like Buergers disease, but the difference is there is no inflammation happening here, but due to some other reasons, the blood vessels are contracted in here and there is no enough blood flow towards the extremities. What may be the reason for this? This is mostly caused because of the patient's exposure, prolonged exposure to cold or stress. Imagine you yourself holding some ice cubes in your hand for a long time, and you can see that vasospasm happening on our fingers. That means the fingers might reduce the color, may change to blue color. That's also known as cyanosis. Because we are holding the ice cube for a long time, there will be a constriction of the blood vessels to the extremities, resulting in the reduced blood flow. And we can see the discoloration, like the color change on the extremities that time. And sometimes cyanosis means the bluish discoloration of the skin. And sometimes numbness, we can also feel the numbness. We are holding ice cube for a long time, we can feel the numbness over our extremities. This is all because of the vasospasm happening here. And this is seen in Raynaud's disease. Remember, Buergers disease is an inflammatory disease condition where the blood vessels are constricted due to inflammation, whereas Raynaud's disease is a vasospasm where the blood vessels are constricted due to the exposure of cold, and it's only a spasm happening here. And the management here in Raynaud's disease is also vasodilators, and also to keep ourselves warm, keep the patient warm, and also to avoid the precipitating factors like going to the snow or lying down in snow or holding the ice cubes for a long time, or reduction in smoking, stop smoking. Smoking can also result in the vasospasm of the patient. So these are the two very, very small and very, very important topics which have been asked in numerous examinations, because people tend to think that this is a very tiny topic and we don't need to study it. This has been asked a couple of times in the NCLEX examination and central government nursing examinations. So remember, Raynaud's disease or Buergers disease, two disease conditions. They both are vascular disorders. Buergers disease is occurring due to the Buergers disease is the vasculitis of the patient, occurring due to the vasculitis or inflammation of the blood vessel of the patient, and it is intermittent claudication is seen in the Buergers disease. It's occurring due to the inflammation of the blood vessels, resulting in the sore or low oxygen supply to the blood vessels, and the complication can be gangrene. Gangrene is a complication seen in the Buergers disease. And then we studied about Raynaud syndrome. In Raynaud syndrome, what happens is the patient may be exposed to a cold weather or something cold for a prolonged period of time, and resulting in the vasospasm of blood vessels, and which may lead to the reduction of blood supply. And this is can be managed by providing keeping the patient warm or providing vasodilators for the patient. Raynaud's disease is not inflammation, it is a vasospasm, whereas Buergers disease is an inflammation of the blood vessels. Thank you very much for watching the video. Hope you got some idea about the Buergers disease and Raynaud syndrome. Thank you very much. Bye bye.